Our rates of high blood pressure in the U.S. are among the highest in the world. And diabetes, obesity, high cholesterol, physical inactivity, poor nutrition, and smoking are causing us to suffer and die from stroke at alarming rates.
We got to be concerned not only for the spiritual side of people, but as well as, the physical side. American Heart Association partnered with us to bring a program into our community that deals with checking people's blood pressure weekly.
I found my mother has been hypertensive since she had me, and I'm the youngest of three. And I began to notice that my blood pressure was getting higher. I was getting a little lightheaded. I just don't have time to work out. But I had a conversation with my sister, and that really impacted me, that I've got to make a decision to try to fit exercise in some kind of way, because the only time I could is if I get up early in the morning. So she said, well, it just boils down to this. Either you get up early and you work out early, or you die early.
And one of the things I'm concerned about is that oftentimes not all Latino populations are represented in some of the data that we have available nationally, but at the same time I keep reminding people that 2/3 of that population are Mexican Americans. So these are some things that we really need to be looking at and developing programs that really began to address this issue. And recently there was a study out what makes a city healthy. And it's having more green spaces, it's really encouraging activities for families to be involved, getting the community and healthcare community involved in creating these kinds of changes.
I want to be sure we all are framed in our purpose today to transform environments through the creation of a sustainable culture of health in multicultural communities.
Looking at the foods that you're eating, the salt content in those foods, making sure that you're comfortable reading labels and understanding how much salt is actually being taken in through your diet.
But here's what I find really remarkable. 50% of our progress in reducing deaths from heart disease and stroke comes from embracing better health choices. We're talking about lifestyle changes.
We don't just grow vegetables for ourselves because our children are grown, basically. We grow enough vegetables to feed the entire congregation, especially the elderly. We have a healthier congregation initiative. We've partnered with other congregations in the community where we're growing a community garden. That's on a larger scale. We're not going to change it overnight, but I think if we're consistent and we do it collectively and collaboratively, then I think we can make a difference.
So things like eating well or good nutrition, fitness can be leveraged, and not only can a person influence their own health, but they can influence the health of their friends and family members, and then take that to the next level and influence the health of their greater community.